Come in.
Hello, my name is Tiffany. I'm going to be your nurse today. We're going to go ahead and close this curtain and grab some hand sanitizer. May I please verify your first and last name and date of birth against your wristband?
March 3rd, 1989 is my date of birth. My name is Mohammed Munawar.
Wonderful. And would you rather I call you Mohammed or Mr. Munawar?
Mohammed's fine.
Okay. And Mohammed, do you know what date it is today?
It's August 6th, 2022.
Wonderful. And do you know where you are?
I'm at the hospital.
And do you know why you're here?
Yes, I have constipation.
Okay, great. So my patient is alert and oriented ×4. So what I would move to next is I would explain to him that I'm going to take a full set of vitals, which include blood pressure, pulse, respirations, oxygen saturation, and temperature. And when I'm done with that, I would go ahead and ask my patient, now, are you experiencing any pain on a scale of 0 to 10? 0 is no pain, and 10 is the worst pain you've ever experienced.
I'm not in any pain.
Okay, great. So we're going to go ahead and move on to our head-to-toe assessment because we've already completed our interview portion. So I'm going to go ahead and I'm going to perform hand hygiene again. I'm going to get my gloves and I'm going to first just look at my patient. I'm going to see that, he has good hygiene. His skin coloring looks good. It's appropriate for ethnicity. He looks symmetrical in the face, in the shoulders, all the way down. He is not missing any extremities. And then, Mohammed, what I'm going to do next is I'm going to go ahead and inspect your head. I'm going to feel it for any lumps, lesions, or infestations. Okay. I'm going to go ahead. And I don't see any infestations. I'm also going to check your beard. Okay, everything there looks good. And now I'm going to have you look at me. And I can see that your eyes are nice and white. And go ahead and look up for me. All right, I don't notice any conjunctiva or anything. It's just nice and pink. Okay, now what I want to do is I'm going to palpate your sinuses. You just let me know if you experience any pain.
Okay.
Okay, that looks good. And now I'm going to take my pen light, and if you can please just look right at my nose and try to keep your eyes open. Go ahead. Eye. Okay, pupils are equal, round, and they're dilating beautifully. And so the next thing I'm going to, and his eyes don't have any drainage, they're not red. And the next thing I'm going to move on to is his ears. So I'm going to just first assess for pain. Do you feel any discomfort?
No.
Okay, let's try this one. Any
Nope.
discomfort? Okay. So now I'm going to look inside his ears. I'm going to pull the top of the ear up and back. And I'm going to check his eardrums, which look great. I don't see any abnormal redness. There's no drainage. I'm going to check the other one. Same, no redness, no drainage. The eardrum looks great. Okay, and now we're going to go ahead and I'm going to look in your nose. Okay, that looks good. There's no drainage, no redness. I don't see any deviation. So another way I want to test that is I want you to use one hand and close one side of your nostrils and breathe in and out with one side, and then do the same on the other side for me, please. Okay, great. So he has good airflow through both nostrils. And now go ahead and open your mouth. That looks good. His gums look nice and pink. I don't see any redness. His mouth is nice and moist. His uvula looks good. His tongue is nice and pink. He has good hygiene and his lips are moist. They're not overly dry. Wonderful. So the next thing we're going to do is I'm going to look at his neck. And I don't see any kind of lumps or goiters. Okay, so I want to check for JVT. So I'm going to have you lean your head back at a 45-degree angle. That side looks good. And the other side, please. Okay, that looks wonderful. So I'm going to go ahead and check your pulse. Perfect, +2. +2. And I want you to go ahead and smile for me. All right, thank you so much. Do you smile with teeth? Perfect. There's no facial drooping. Both sides look good. And the next thing we're going to do is I am going to listen to breath sounds. So every time my stethoscope touches your chest or your back, I want you to take a deep breath in and out for me, okay?
Okay.
Thank you. Okay, I'm going to listen to your back now. Okay. Breath sounds are clear bilaterally. And now the next thing I want to go ahead and assess is your GI system. I know we're having a little bit of upset there. So I'm just going to listen for vowel sounds, okay? I'm going to go ahead and help you lean back. Okay. Okay. We have normal active vowel sounds on both sides. So the next thing I'm going to go ahead and do is I'm going to go ahead and palpate your abdomen. I'm going to start with soft palpations and only go about 2 centimeters, okay? You let me know if you have any discomfort.
Okay.
Okay, and now I'm going to do deep palpations, which is about 4 to 5 centimeters. It might be a little uncomfortable, but you just let me know if you experience any pain, okay?
Okay.
Okay, everything feels good. I'm going to go ahead and help you sit up. Okay, and now I'm going to go ahead and do a skin inspection. So I'm going to go ahead and start with your arm. And the coloring looks good. It's warm and dry. Okay, I'm going to go ahead and check your knuckles here. I don't notice any redness or swelling. And I'm going to take your radial pulse. Looks good, +2. And now I'll check the brachial pulse. Oh, we're in here. We'll be out in a minute. Okay, that feels good, +2. I'm going to check the other arm, which also is warm and dry. Don't notice any abnormalities. No swelling or redness. I'm going to check this radial pulse. Great, +2, and the brachial pulse. +2, and then I'm going to check those capillary refills here, which look great. They're all filling in less than 2 seconds. Your hand, please. Okay, great. And now I'm going to go ahead and I'm going to move down to your legs, which they look great. I do see that there's hair. There's no issue with it being shiny and hairless. And I'm going to check for edema by pushing along the front and just kind of seeing if there's any like pitted areas, which I'm not seeing any here. Okay, looks great. And then I'm going to move on to the feet, where I am checking for hygiene. The toenails look good. They're clean. There's no fungus. I'm going to go ahead and feel for any swelling or abnormalities, which I don't see. I don't see any sores. I'm going to check this foot. It looks good. We're going to check those capillary refills on both of the feet. And they're all filling within 2 seconds. And now I'm going to check the posterior tibialis pulse. Looks good, +2. And on this side, great, +2. And now I'm going to check the dorsalis vetus pulse. Feels great, +2. And also a +2. And we're going to go ahead and check your reflexes. Great. Perfect. And then the bottom of your feet. This might be a little uncomfortable, but it shouldn't hurt. Okay. Thank you. And then on this side, it tickles a little bit, huh?
Yeah.
Okay. All right. So, I mean, overall, everything looks great. I'm going to go ahead and perform hand hygiene, and I'm going to document.